Did you know that shocking news and distress may lead to heart problems? Although this is seen more commonly on postmenopausal women, you may also be affected if you are a male. Hi, class. I'm credible in speaking to you about broken heart syndrome, also known as cardiomyopathy or Tabakusu. I am butchering that name. I apologize. Um, I'm credible to speak about this disease today because I was interested in learning more about the disease that majority of my patients struggle with. Um, I'm going to introduce to you broken heart syndrome and some of the triggers and symptoms of it. First, let's get into the causes and how you get diagnosed. What is the cause of the disease? The cause of broken heart syndrome or stress-induced cardiomyopathy is not well understood. Cardiomyopathy is a medical condition in which the heart's ability to pump blood is lessened because its main pumping chamber, we have four, the left ventricle is enlarged and weakened in some causes. This prevents the heart from filling with blood as it should. Over time, it can affect the other three chambers as stated on WebMD. It is thought to be due to increased stress hormones or dysfunctional heart arteries. How is the disease diagnosed, you may ask? Broken heart syndrome or stress-induced cardiomyopathy is diagnosed in those who present with symptoms of a heart attack but have normal coronary arteries. Once you have ruled out blocked arteries, you can diagnose the disease with an ultrasound of the heart, which is also known as an echo or echocardiogram. What is the expected outcome for someone with this disease? Majority of the patients recover in a few months or a few weeks, sometimes even months. Not sure if I said that, I apologize. Although some patients will continue to have a weakened and will be managed with medication, as stated on WebMD, some of these symptoms of cardiac disease include fatigue, weight gain, palpitations, which is fluttering of the heart, or also known as abnormal heart rhythm, and blood clots in the dilated left ventricle because of the pulling of the blood. So I guess our left ventricle is working just a tiny bit more harder than the other chambers, which could cause the heart to be stressed. Hence, stress-induced cardiomyopathy. This is there current research like vaccines, medications, availability or side effects, etc. There is in fact a lot of research all over the world working towards understanding the main cause of cardiomyopathy, broken heart syndrome. Cedars-Sinai is actually one of the ones doing research on it. Dr. Erica Jones is part of that research program, which luckily I was able to interview her and get some of the questions answered in regards to, exactly what cardiomyopathy, stress-induced cardiomyopathy would be. Unfortunately, right now, there is no vaccine to prevent the disease. There is, however, medication treatment. These medication treatments are beta blockers and standard treatment for heart failure. Are there any risk factors? Examples like age, gender, genetics, etc. The disease is more common in elderly women and those with a history of psychiatric disorders. Older postmenopausal women are more likely to get stress-induced cardiomyopathy. At this moment, it's not known why it's targeted, not that it's targeted, but why more postmenopausal women have this heart disease. It's still being researched. And are there any symptoms and signs? Yes, there are a few symptoms, as I mentioned before. It's somewhat kind of like a heart attack. So if you have sudden chest pain, if you have shortness of breath or palpitations and even passing out, you might want to get a consultation with a cardiologist to rule out cardiomyopathy. Um, Another thing is the heart muscle is weakened, and most of the time, cardiomyopathy has a very characteristic appearance with the ballooning of the apex of the heart and hypercontraction of the base. This was stated by Dr. Erica Jones over at Cedars-Sinai. And in conclusion, because there is no proper procedure for knowing what causes the disease, it's best to see your doctor to proceed with testing and seeing a specialist, which would be a cardiologist. And it would actually be the cardiologist testing you with a echocardiogram and a CT angio and a coronary calcium scan. As I explained, the symptoms and testing take into consideration, you should see a doctor if you feel this might be a reason for unexplained chest pain and shortness of breath. As I went over broken heart syndrome, there is no cause for it other than triggers such as unexpected news, stress, and how it will affect your heart arteries. Thank you.